Hello, brains. Thank you so much for your patience. We had technical difficulties. Also, we were running on ADHD time, in which you can do something at 9:30, or you can show up for your call time at 9:30 and then do Instagram live for half an hour and then immediately jump into the live stream where we didn't allow any time for transitions, and then we had technical difficulties. So thank you so much. Hi you guys. Thank you. Who is ready to overshare? Woo! I'm going to talk about my comorbidities. We're so excited because this is for Mental Health Awareness Month, which is May. ADHD Awareness Month is in October. We're going to talk lots about ADHD all year, actually, but also in October. This month, we want to talk about the other things that tend to come with ADHD: depression, anxiety, autism, learning disabilities, oppositional defiance, PTSD, all of these things that we tend to deal with on top of our ADHD. So if we're only addressing the ADHD, these other things are not getting the attention that they need and they deserve, and it can actually get in the way of us effectively addressing our ADHD if we don't. So I asked Dr. Patrick LaCount to come on. Dr. Patrick LaCount is an ADHD researcher. He's a doctor of clinical psychology. He has his own practice in Colorado now. So if anybody's in Colorado, he's available, but not for long, probably after this live stream, because he just started his own practice. He's been helping out with the channel for years. He's half of why the channel is so good. It's his research, his insights. And one of the things that we did for a while every week is we would talk to each other. I would run things by him and I'd say, this is what my community is struggling with. What does the research say about this? Let me make sure I understand it. I got to pick his brain every week. And so what we're doing today is you guys get to pick his brain. So we're going to do exactly what Patrick and I usually do, which is just talk about, well, what is this? And what does this mean? And what about this? And what does the research say about that? And he'll offer his insights. And I'm going to be basically pulling questions from the chat and then giving them to Patrick. So that's what we're doing. Super chat is on. If you really, really have a question that you want to make sure that we see, and you feel like donating to the channel, don't feel like you need to. I'm going to pull questions from regular chat as well, but it's just ADHD and the chat goes really quickly. So I'll be able to see it better if you do super chat, but please, please don't spend money you don't have. We are okay on the channel. Any support you give, we appreciate, but we're doing fine. So take care of your own finances as well. ADHD PSA. All right. So how do you find this practice? It'll be on the lower third. It's practicalpsychservices.com. And yeah, let's introduce Patrick. Enough of me. You guys see me all the time.
Yeah, so it's a pleasure to meet everyone. I've kind of been working more behind the scenes for, what's it been, almost 4 years now?
Yeah. Patrick emailed me, hey, do you need some help with research? And he attached his resume. And I'd been getting some help with research here and there from other people on the channel that was already really helpful. But he was an ADHD researcher specifically. So I was like, oh my gosh, yes. I was so enthusiastic about it. And he's been helping ever since. So.
Yeah, no, it's been an absolute pleasure. I was in the academic game, pretty hardcore in the paint, and then decided I really like the private practice work. So back in Colorado where I grew up, and yeah, just loving the new life and working with people in the community that I care for so much. All the research, all the clinical work has been incredibly rewarding. So yeah, glad to be here today.
Thanks. I'm so excited. This might be my favorite thing I've ever done.
Yeah. Cool.
Sammy says, you have made my life so good over the last 6 years. I hope you keep making videos to help our fellow brains. Oh my gosh, you've been with us from the beginning. Thank you, Sammy. We will. And these donations definitely help. We appreciate it. What is Super Chat? Super Chat is, it just boosts your chat up. So there's this cool thing where I can actually see the comments and a little countdown timer to make sure that I click on the comments before it goes away. So it just helps it so that I can see your comment better. But again, I will be looking in the regular chat for questions as well. It's just if you want to donate to the channel and definitely get your question answered, or probably, I shouldn't guarantee because I also have ADHD, I might get distracted. But because you said not to, thank you, Jesse. Thank you, guys. Advice, okay, so advice for a psychiatrist who says lack of concentration is part of my depression. I'd love a true ADHD diagnosis. Okay, that's already a hard question.
So the person is a psychiatrist?
So,
or a psychiatrist?
I think part of my depression. So I think Courtney, correct me if I'm wrong, but I think Courtney saw a psychiatrist who said lack of concentration was part of the depression and didn't get an ADHD diagnosis because of that.
Yeah, that's a really good question. So a lot of the time, so as far as how people go about assessing that, uh, looking at the chronicity of those symptoms over time is really important when we're evaluating ADHD. So in your case, your psychiatrist may have heard, well, I was doing really well in school in childhood, didn't really have any problems in class, was really organized at home, didn't have a problem completing chores and assignments. And then something changed. Whether that was like a significant event that preceded a depressive episode, um, that's oftentimes why we might rule out ADHD in favor of that depression diagnosis, or say until depression's managed, we can't confidently give that diagnosis because chronicity. We want to make sure it's over time, there's evidence of symptoms, and that those symptoms are related to impairment across settings.
Yeah.
Yeah.
And so it doesn't mean that they don't have ADHD. It just means the depression is kind of getting in the way and making it so they can't tell, or
Yeah, it's possible. So they could definitely have ADHD, unless, of course, if the fact that in childhood there was really no evidence of ADHD symptoms, then that would suggest to us that regardless, let's say you get your depression well managed, we would still rule out ADHD because that childhood symptom criteria is not being met.
yeah. Okay. But there's also second opinions. My very first doctor told me that I couldn't have ADHD because I was too smart.
Yes.
So
Yeah.
I generally, if I generally personally feel, if you feel strongly that you had the symptoms as a child and you think you have ADHD and your doctor is saying no, it's just depression, and they don't understand ADHD very well, which also happens. Like, I personally say get a second opinion. But yeah, there
It's something. Oh, go ahead.
but distractibility can be caused by other things, I think is the point, right? Like lack of focus
Yeah.
can be caused by anxiety or depression or other things as well.
Right. And something I would add too is a lot of times the people that get missed in childhood, there's a couple common themes. So one of them, it might be that they have a higher IQ, and we know that can be kind of a protective factor. And then let's say they go to college or grad school, and those demands on executive functioning ramp up past the point where you can compensate for that. So there's things like that, or you're getting kind of informal accommodations from teachers, parents.
Hey, Steven, they can hear you typing.
I didn't get that. Could you try again?
With you and made sure you got your homework done and had, a token economy system at home and made sure you didn't lose belongings, and teachers gave you extra time on assignments, didn't, they were very flexible with you. Sometimes those can be missed because it was as if they were treating you as like you already had ADHD. And it's like, well, no, I didn't have problems, but you were also getting a ton of help.
Yeah, for sure.
Yeah.
This is actually a great question. For Patrick, what is the percentage that somebody with ADHD also has a comorbidity? Is it greater comorbidity for some more than others too? So like, how many people with ADHD, like percentage-wise, tend to have a comorbidity? And then are some comorbidities more common?
Yes, that's a really good question. So something we'll say as researchers and psychologists, for ADHD, comorbidity is more often the rule than the exception, right? So you're more often than not going to have something co-occurring with ADHD. So the seminal study on this, or kind of big gold study for this, was the MTA study. So they did a lot of things in that study, and one of the things they evaluated was comorbidities. And they found, I believe it was around 30% just had ADHD alone. The other most common disorders were tic disorders, mood disorders,
Like motor tics?
anxiety.
Yeah.
Yeah, and that a lot of times can be related to the medication. So maybe that's not the appropriate dosage. And then like behavioral, so oppositional conduct disorder, learning disorders. Yeah, those are kind of the common ones. So more often than not, comorbidity is the rule than the exception. And that continues across the lifespan. It's just the presence of certain disorders fluctuates. So mood disorders go up in adolescence and young adulthood and continue on into adulthood with ADHD, where for younger children, that's less common.
Is that like bipolar? Because I'm getting a lot of people asking about bipolar. So
No. Yeah, so not so much bipolar. That's more, when I say mood disorders, that's more kind of depression. Certainly bipolar could be wrapped up in that, but that's fairly uncommon.
So people
Yeah.
with ADHD, are they more likely to develop depression than somebody without ADHD? Like somebody who's neurotypical, do you know?
You know, I, I so I'm very careful. So Jessica knows this, but I'm
Yeah.
very careful with saying like I certainly know something now. So I'm not certain, but I'm fairly sure that is the case. Yeah, and a lot of times, Mike Meinzer, he's now at Illinois Chicago, does a lot of great research on this. Is why does depression develop with ADHD? Is it the ADHD impairment is causing the depressive symptoms? Does it work in some other way? Why does this happen? So yeah, I would imagine fairly confidently that yes, that is the case.
And by the way, this is what I love about researchers. They are so cautious. Like I'm like, yeah, absolutely. He's like, well, this and that and the data, and we can fairly confidently say this. As soon as he made that face, I've seen that face on Patrick so many times where I'm like, well, this is the way it is, right? And he's like, well, and he'll explain that it's complicated, and that's one of the reasons why the research that I present on the channel is as good as it is, because things that seem like, well, obviously, he's like, well, this is what the research says, and sometimes we just don't know yet. Sometimes there's more to be learned. So thank you for thank you for being honest about that. I love that.
Of course.
So people are asking about bipolar, bipolar plus ADHD. So I know that because of the emotional dysregulation of ADHD, sometimes people are misdiagnosed with bipolar when it's actually ADHD, right? But then it is possible to have both, right? ADHD and bipolar.
Absolutely. Yeah, I'm not sure what the base rate is or the prevalence rate. I'm not sure which is the correct term, but yeah, you can certainly have both. However, I'm always very cautious with bipolar, particularly in children. It's fairly rare that we'll see that. So just because it's rare, that's one reason to be very cautious about giving it. And also, those medications are no joke.
For bipolar.
Lithium bicarbonate, for example, requires constant maintenance and monitoring of blood levels, like lithium in there, and has pretty big impacts on mood. But you can certainly have them co-occur. And yeah, bipolar, there was a big rise in bipolar. I think it was about in the 90s, and it got a bit overdiagnosed and has since been reeled back in. Because often that criteria, the mania, so there's different types of bipolar, but when we think of the stereotypical bipolar, there's that big highs, big lows. The mania is on a different level, and it's sustained for I think about a week or so.
Okay, so it's not like ADHD, I got really excited, enthusiasm for a couple of hours.
No, and that's, I think, an issue with researchers and us not doing a good job of communicating that, because, yeah, it makes sense. Like, does your child experience mood swings? Absolutely, do they? Yeah, let me tell you, doc. Yeah.
But with bipolar, the mood swings are longer generally, right?
Yeah, they're more prolonged, and the mania is next level. So imagine like not sleeping, doing things that are really impulsive and dangerous. Yeah.
Do you have any advice for how to be productive when you have bipolar and ADHD? Like, right?
Ooh. I mean, so first and foremost, I think obviously this would have to tailor to the case, but med management is pretty big. Keeping things steady for an individual with bipolar, like you're kind of walking a tightrope. Is the way it's been described to me, is like you're just trying to stay on this balance of, okay, I've got my med management and I can't have too much of my life changing. Otherwise, that's when things kind of get off the rails a little bit. And then if you add ADHD on top of that, right, you can imagine you naturally get more variability in how your day-to-day stuff goes. So I think managing the bipolar first, I think that probably takes precedent. But then incorporating ADHD and, okay, how do I maintain stability in my life and consistency and support within an ADHD framework? So for an individual with ADHD, what does that mean? Yeah, I'm tailoring it to that.
Yeah. Oh, that's a good question. Like once you make sure that that it is bipolar, because it is sometimes misdiagnosed in ADHD. Okay, do you want a super nerdy question?
Oh, do I? Yes.
Okay. In terms of polyvagal theory, does research show a link between an overactive sympathetic nervous system and the presentation of ADHD? I noticed my ADHD symptoms decrease with calming my nervous system. This might be outside the scope of what you know as a researcher, right? This is like kind of alternative stuff, yeah?
Yeah. So basically, if you are more calm, does your ADHD get better regulated? Like, is that kind of the gist? I mean, there was the nerdier bits of it.
Yeah. Basically, like I noticed my ADD symptoms decrease with calming my nervous system.
I could see, so there's some evidence to suggest that mindfulness-based interventions can be helpful for individuals with ADHD. I think there's been studies for adolescents and adults. I'm not sure for children. But there's been some decent evidence that it can be beneficial. And as far as the mechanisms of action, I'm not as familiar with those. But I would think anecdotally, thinking a lot of individuals with ADHD report anxiety. They have this history of perceived failure or underachievement. And a lot of times when you're starting, let's say, to try to do this assignment that you're scared of, that you want to do well on, but I've never been able to do well on these things. They always take so long, and it's so hard for me to just keep my mind here, that if you're able to kind of just ground yourself into just the present moment and not just letting those thoughts snowball, you might be able to approach those things a little bit better. So yeah, I think there could be some evidence to it. I'm just not sure if that specific mechanism,
Yeah, interesting. Okay, cool. Well, this is one of the things that's fun with Patrick is I'll bring things up and he's like, I hadn't considered that, and he'll end up going down a research rabbit hole and usually come back at me with some stuff later, so that might happen. By the way, Patrick will also, he's generously offered to answer questions that we can't get to or that are a little more complex in the comments for the next day or two. So definitely after the live stream is over, leave a comment there too, and Patrick will do his best to get to those as well.
Ooh, and one thing I want to add too. So my social media things, like Jessica said on her Twitter, she asked me to make those. If you guys follow me on there, you'll be my little accountability buddies. And then it's like, okay, I need to publish like good
content, yeah.
The ADHD community.
So follow at Dr. LaCount, at Dr. LaCount on all the platforms, right? And then maybe he'll post some content for us. I was just like, you have to have social media, so.
Yes. I'm not sure if I'll be posting on TikTok anytime soon. I'm just not sure if I've got the dance moves, but we'll see.
Let's see. So people are asking, there's so many good questions here. Okay, I know a big one that people have that I keep seeing come up is ASD. And I know you worked with autism as well for a while there. So ADHD and autism, is ADHD a comorbidity of autism? Is autism a comorbidity of ADHD? Are they just, what's the deal there? And where's the line, right? Because there was actually a brief period of time where I was like, do I have autism? Because I have sensory issues and I have this hyperfixation on learning and studying ADHD. Like I have trouble reading social cues. Sometimes does that mean I have autism? So where is that line? And what's comorbidity of what and all of that?
Yeah, that's a really good question. So the first part, what's comorbid with what? So if we look just in the ADHD community, the comorbidity rate is fairly low relative to all the other disorders we've already talked about. But within the ASD community, it is the highest rate of comorbidity, ADHD. So
within the autism
if you're looking
community,
at it,
you said?
Yep,
Oh,
it is
okay.
it's the most comorbid disorder with autism spectrum disorder, if we're just talking about mental health problems. So there's that. And then as far as the differences between the two, it's interesting. I don't know enough about the etiology or just kind of sort of the development, the contributors to the manifestation of autism spectrum disorder. There's obviously a lot of environmental and neurobiological influences there, and genetic as well, just like there are with ADHD. But as far as differences, I mean, you were talking about kind of the, what is that? I can't think of the word, but like you have a very strong interest in something.
Oh, you're talking about hyper focus or hyperfixations?
So hyper focus with ADHD, differentiating that, the way I understand it is like you just get sucked into something, like time starts to kind of just fade in the background, all the other things fade out. And maybe you didn't want to spend as much time going down this like rabbit hole, but you did.
Or didn't intend to. Maybe you wanted to. You were just like, oh, wait, where did the time go?
Right. And then for autism, that can be, I've worked with individuals who it is the same 20-minute segment of a Barney VHS tape. And like watching that, stopping, rewinding, watching that, stopping, rewinding, or, Thomas the Tank Engine, or like things like that, where they know a lot about a very specific thing. Um, yeah, so that's where it gets a little different. Or there's kind of like the close inspection. So a lot of times, like seeing how wheels are going, or if something's like really sparkly, that's another thing we'll look for when we're evaluating ASD. Uh,
And
it's
then
been a while since I've
the
done
social
anything else like,
differences too, right? So picking up on social cues.
yeah, and that one could just be the attentional aspect of ADHD kind of contributing to that.
That's what I've seen. That the
Versus,
difference is like if you have ADHD, you miss the social cue because you were distracted. Versus autism, you could be present and not distracted and still miss that social cue, right?
right, yeah. And then something too socially that happens, and I've noticed this a lot recently, is in younger age, having those ADHD traits, you're kind of the fun student in the class relative to your peers. It's like, oh, they're goofy, they're the class clown. But as you get closer to like fourth, fifth, sixth grade, it starts to become annoying. And it's like, oh, you're getting me in trouble. I'm trying to focus because now we're doing, solo work, and you're getting in the way of that. So it's not like at first it seems like socially things are fine, and then all of a sudden parents, teachers will say like, yeah, it seems like things kind of just went downhill for Timmy, and we're not sure why. He used to do so well with other kids, and a lot of times it's just how people view their peers throughout development. Yeah.
Yeah, I saw Dr. Barkley had some research that said that most kids with ADHD don't have a single friend by the third grade, which I cried
Russell,
reading that research. Huh?
Russell Park, who's he?
Dr.
I'm
Russell
kidding.
Barkley. Haven't heard of him, right?
Kidding. He's the man. Yeah.
All right. People want
That's
to
really
talk about, let's
fascinating.
see. Okay, let's talk about ADHD and OCD. Struggle with managing both, and I saw a couple of comments too of like, I really hate untidiness, but I also, my ADHD gets in the way of being organized. I don't know if I've ever talked about this on the channel, but I was diagnosed in high school with mild OCD. I was diagnosed with ADHD and mild OCD. And it's really interesting because they do feel like they fight each other sometimes, where I'm just like, my OCD wants me to be on top of everything and everything to be like a certain way. And one of the ways my OCD shows up is I will read and reread and reread my scripts until like it's as polished as possible. And I actually find that soothing, and if I can't, it makes me really anxious. There's OCD obviously shows up in different ways for different people, but I do find it competing with my ADHD. And what was the question? I forgot already. I struggle with managing both, dealing with medications for both reduce effectiveness for each other. So that was a big thing for me. So I was taking ADHD meds, and then I took Paxil. I took medication for my OCD. But my impulsivity got so bad with ADHD because I wasn't having it felt like there were no thoughts in my head and there was nothing holding me back from my impulsivity. So I actually ended up having to go off of that. So yeah, I'm super curious about this too, like ADHD and OCD, how they play together.
That's really interesting. See, this is also why I love working with the channel, is because it's one thing I get to read papers and all that, but it's nice to hear actual stories that bring these things to light. So as far as OCD and ADHD, this isn't, I haven't done a lot of research on this, and I'm trying to think if I have any history working with people who have both. Usually if they come in, it's, one is the main focus of things. So OCD, for people who don't know, tends to manifest in one of two different ways, or there's two components to it. You can have the obsessive thoughts that are just kind of intrusive, always there, and you're trying to manage them. And the other one is like the behaviors, so the compulsion part of it. So I'm trying to think in terms of compulsion. I mean, I guess with both of those, there might be a case where the difficulties in self-regulation could come up and then make it harder to regulate in those moments of, okay, I'm not going to go and check the stove for the third time. I'm not going to engage in this ritual of counting things in threes in order to avoid some catastrophic event. Yeah, so I think maybe it just gets in the way of therapeutic treatments or potentially med management too, right? So taking medication consistently um, might be an issue there. So, hmm, yeah, I don't know. That might be one I come back on
Yeah.
because now
I'd be
that
super
piques my
curious.
interest.
And maybe that's
Yeah,
something we can do an episode on the channel about at some point too, just ADHD and OCD, and I can talk about my experience with it. And it really is
yeah,
interesting because I could not treat my OCD without making my ADHD worse. That was me personally. But I also have, I have friends that have both, and the OCD is so bad that they definitely need to be treating that. And that's more important for them. But for me, the ADHD is what's worse, and the OCD for me is manageable. So
yeah,
for me, I'm like, let me focus on my ADHD. But for other people, it might be different.
yeah.
Yeah. So thank you for that question, Ivan.
It's a good one.
Let's see.
Really good questions.
Oh, see, okay, another OCD one. Yeah, I have had ADHD my entire life. I later developed severe mental health issues and recently was diagnosed with bipolar type 2 and OCD alongside ADHD. How common are these three disorders to be comorbid?
I would imagine not.
Yeah,
I mean, just naturally, as you add more things to it, it becomes less common, right?
yeah,
So, yeah, lots of bipolar and OCD stuff. That's interesting. And that's another thing is researchers, we kind of get fixated on what we think is important. And then just in like 10 or 15 minutes and talking with you guys, hearing about, well, no, bipolar's on our mind or OCD's on our mind. So that's really interesting.
yeah. And then this one, Adar Farrell, I'm not sure how to pronounce that, is asking the very question I wanted to ask as a follow-up, which is, do you think the forgetfulness with ADHD contributes to developing secondary OCD, like the need to check? I've seen papers with OCD mimicking ADHD via executive overload. Is it like a chicken and egg situation? Like, do I have OCD because I had to compulsively recheck things because I missed things because I have ADHD? Is that possible to develop?
That wouldn't technically meet criteria for OCD,
Really?
just the way that OCD is conceptualized. That's more of just like again, you're almost overcompensating.
Is that more anxiety, do you think?
That's more kind of, and there's debate as far as like, yeah, if OCD should be conceptualized as an anxiety disorder. I tend to fall into that camp, but that's hotly debated amongst those researchers. Uh, but yeah, that would be my conceptualization. But of course, I'd want to hear more from the person of, yeah, when you're doing that, is there a feared outcome that you're trying to avoid? What would happen if you didn't do that?
Yeah.
How uncomfortable would it be knowing like, oh, I'm going to go check this, and I said, well, let's try to stop. You know, yeah,
Well,
just to figure out how much of this is anxiety versus ADHD.
Yeah. And it gets so confusing because while I was diagnosed with mild OCD in high school, later on, my psychiatrist re-diagnosed me as an adult. She was like, I don't think it's OCD. I think it's OCPD, which is obsessive compulsive personality disorder. And I was like, what's that? And she goes, type A. You're a type A person. And I laughed and I was like, no, I'm not. Like, I'm not on top of anything. What time did this live stream start, you guys? Like 37 minutes after it was supposed to? Like, I don't have that. And she goes, just point blank, looks at me and goes, you also have ADHD. And I was like, oh, right. Like, I want to be the person that's on top of everything and starts on time and all that. But like, I'm not because of this. So it's interesting how they all interplay together like that.
Yeah.
But you mentioned the thing about anxiety disorders. Okay, Nahima was like, I think that might be how you pronounce it, but correct me. Can you please talk about anxiety and ADHD? Specifically how to get to sleep when your brain won't shut up. Anxiety is something that I also have a diagnosis of. I have generalized anxiety disorder. So many people have with ADHD. I know that's not a statistic. I'm not the researcher. A lot of people that I talk to in my community have anxiety in addition to their ADHD. And this whole COVID situation, the whole last year, and now the fact that the world's opening back up has actually made that anxiety worse for a lot of people. So, just do you have any insights in general, Patrick, on ADHD and anxiety? If we were going to do an episode on the channel about that, what would you say are the most important things for people to understand about that?
Yeah. So many things. So one of the things that you and I learned in one of our conversations was, is ADHD medication contraindicated if they have co-occurring anxiety? Will it exacerbate it? And I remember initially we talked about it and I was like, well, it's a stimulant, so I can't imagine that would be helpful for anxiety. But then I looked at the literature and no, it's actually quite helpful. So that's a common kind of myth out there that a lot of people still believe, understandably so, because even I study it and I thought that makes sense. And I believe that the reason or the rationale behind that is because you can better control your thoughts and where your anxieties are going and kind of stopping that snowball before it gets too big and it has too much momentum and that's all you're thinking about. So there's that. And then, generalized anxiety, I believe, is the most common anxiety disorder that co-occurs with ADHD.
Which one
And
is?
it generalized.
Okay, yeah.
So, for people who don't know, it matches the name. It's not just I'm worried about one specific thing. So if somebody said, I'm just worried about school, that's not indicative of a generalized anxiety disorder. That would be more of, I worry about, school, how people perceive me, what am I going to do in the future, if my mom's going to get home okay. Like it kind of, it bleeds into everything. Like, and people who've come in with GAD, they tend to describe themselves as I've always been a worrisome person. My parents have always said I've been kind of anxious about things. And then, there's that question that was asked about sleep and getting to sleep at the end of the night. So that's a fairly common problem for people with ADHD, as I'm sure everyone knows. So one, medication, making sure, trying to time that so it's out of your system before bedtime. The other one's mindfulness exercises. So people always ask too, like, well, which one do I need specifically? And go on YouTube, put in however many minutes you want to do and say mindfulness exercise. And there'll be a million videos and find someone whose voice you like and demeanor, do that. So a lot of times I can help kind of ground you, get your thoughts down. And then like nice, big, slow, deep breaths, like in through the nose, out through the mouth, like really like that belly breathing, and focusing on that can be really helpful. And then just general sleep hygiene, right? So not getting caffeine close to bedtime, reducing screen time hours in advance, kind of setting a routine. Be in your bed only when you're trying to go to sleep. And if you have trouble getting to sleep, after a bit, get out of your bed because you want to kind of cue yourself to fall asleep a certain way. It's a reason like I have a sleep mask. And that I think kind of triggers, that goes over my eyes. In part because if a little bit of sunshine hits my eyes in the morning, I'm up. But I find that I'll be sitting there like scrolling on YouTube for like an hour and then I'm like, all right, Patrick, you need to go to bed. And then the second I put it over my eyes, I'm out within a couple of minutes. It just kind of cues my body like, oh, okay, it's bedtime now.
So having a ritual, because Olivia was asking about DSPD and I was like, what is it? Delayed sleep phase syndrome. I'm like, oh yeah, of course. So any tips for managing it, and same thing, right? Having good sleep hygiene and having cues and rituals and stuff. And also, I don't know, like I also don't think that I will ever start waking up at 7 a.m. intentionally. Because I know because of delayed sleep phase syndrome, my melatonin kicks in later. I get sleepier later and I do better. Like I sleep better, genuinely sleep better. I'm not on the schedule right now, but I sleep better if I go to sleep at 2 a.m. and wake up at 10. I get my best sleep. If I need to adjust that because I want to make sure that I'm up by 9 a.m. and at work by 10, I can do that, but I don't sleep as well.
Something I would say to that is just there are natural differences in where people work at their best. I think we're all given this idea of like people who are successful get up early and they do this. It's like, okay, that works for them. Other people require 3-4 hours of sleep. Most people don't. They need much more than that. But there are some people who are like that, and there are other people who are night owls. And that stuff can change throughout development too, right? So teenagers require a different type of sleep and may be more prime in the evening time. So the thing to keep in mind with sleep stuff and with any research is we're working off the average. So just because the average person, goes to bed at this time or wakes up at this time doesn't mean that everyone in that group does. Like there's always variability. So that's always something I like to keep in mind. But yeah, people are different.
The second half of the question, and I actually have the same question too. How do you handle like not letting the boredom at night get to you? Because if we're constantly seeking stimulation, right? And so if you're going to sleep at night and you're bored, I've noticed a couple things. One, I have the impulse to do something to entertain my brain. Or two, if I don't, my brain is like, let's think of every awful thing that could ever happen tomorrow. Right? It's like your brain finds a way to stimulate itself and keep it awake. How do you deal with that?
That's a good question. So, I mean, the first one I think of, and it's only, this is anecdotal and I use it for me, is like exercise. That's one that it's like I run myself into the ground. So then my brain will turn off a bit. And it's a nice way to transition from work mode to like I'm working out, so I'm focusing on my breath and how hard I'm sweating and how I don't want to lift this weight or whatever.
But not right before
And
bed, right? Because that can keep you up too.
no, for some people, certainly.
Okay.
So there's always that, and then I think too maybe the mindfulness strategies and the same thing, reducing screen time and all of that. What can be helpful is I don't know, you can be bouncing around a lot on a screen, in different notifications that kind of is priming your brain and getting hit with dopamine constantly. And then you're like, okay, bedtime. And then your brain's like, that's about, but the dopamine, guys, like the dopamine, like I need it. So I could see that. I don't know. I'm curious because, I don't have ADHD. Like has there been anything that you've tried that's been helpful, or just as useful, like things that haven't worked?
I'm curious if you guys have things. For me, I guess it's a ritual thing. When I was a kid, I wasn't allowed to stay up late. Obviously, my parents would watch TV down the hall, and I had bunk beds with my sister, and we would open up the door crack, and we'd be able to watch TV while we fell asleep. And so for me, that's how I get to sleep. But I know the blue light can keep you up, right? And so our team will actually fall asleep with the TV on too, but it's set to a timer so that it will shut off so that it's not disturbing their sleep once they're asleep. For me, it's often the last thing that I do before I go to bed at night is I'll watch an episode of something that's not too exciting. It's just like, right now it's Bones. I'll watch an episode of Bones and I'll start to get sleepy there. And then once I'm sleepy or like half asleep on the couch, then I will drag myself up to my bed and go to sleep. Because if I go to bed and I'm laying in bed and I'm not tired, then I'll start to associate the bed with I'm not sleeping. Why am I not sleeping? I'm supposed to be sleeping. Whereas the couch, I'm like, well, I'm not supposed to sleep on the couch, so I don't care. There's no anxiety there. But I also have restless leg syndrome, which can also be comorbid with ADHD. And I now take medication for it, and that's really helpful. Restless leg syndrome is like not the same as fidgeting. It's not the same as normal restlessness. At night, I want to tear my jeans off of my legs, and I need to like kick things. It's so bad. I have to move my legs, or there's this incredible amount of distress. So that will keep me up at night too. Let's see. Okay, lots of people want to talk about substance use disorders. Let's talk about self-medicating.
Yeah. How about
or
that?
becoming addicted to your prescribed medication. Let's talk about it.
Ooh, other great questions. So the longitudinal studies that we have so far show this is one thing I always want to point out, show no negative long-term side effects of continued medication use. The only one that's occasionally come up, and it hasn't been replicated across studies, so it's been very inconsistent, is potentially stunning growth. So people being a little bit shorter. But again, that's not a consistent finding. So multiple longitudinal, well-designed studies have found mixed things with that. So yeah, there's a lot of parts with that. And then you said getting addicted to your medication.
Mm-hmm.
Yeah, so I guess I'm trying to understand like when that would come up. So is it like you're requiring more and more, or you want to stop taking it for maybe personal reasons or side effects, but then have a hard time stopping? Like, what do you think?
I'll see. But I know a lot of people are concerned if we have more of a propensity to become addicted to substances, and then we're taking this highly controlled substance, right? These amphetamines,
yes.
like,
Okay.
Are we going to become addicted to them? And then it can
No.
almost feel like it
Yeah.
from like I know the research on this and I want you to talk about it, but
Yeah.
I know that for me it can feel like that when you're going through what feels like withdrawals of like the next couple of days after I stop taking my meds. I'm like hungry, I want to eat everything, I want to sleep, I'm like I have a really hard time focusing. Oh yeah, Steven's popping his head up. He's like, me too. So yeah, that's the thing. It's like, oh my god, like, am I addicted to these things? Because why am I so brain foggy and like I can't focus and whatever? If I stop taking my meds. So yeah, do you want to talk about
Yeah.
that?
So as far as the brain foggy, maybe like change in mood is another one, hunger, stuff like that. A lot of it is just, yeah, if your norm for the last years sometimes is always taking this medication, and that's how you've experienced life, and then you're pulling it away, it's probably an interaction of both your brain trying to like get back into the normal routine and homeostasis, but also just your personal experience. If you woke up every morning and had your stimulant, and then maybe 30 minutes to an hour later you start to feel a kick, and like you're able to naturally start going into things, and then you stopped, and maybe it's harder for you to initiate things, your hunger is more prominent. It's just, it might be that to some extent that was your past experience, but you got used to your 2 years experience on the medication.
So like in contrast, it feels like
Right.
it, but you're just not remembering like how it was before you took meds, kind of.
Potentially, I imagine it's an interaction of both of those
Yeah.
things, right? So there's that. And then one thing I think it's really important to convey. So taking medication, and does it increase risk for substance use? So there have been a lot of studies on this. Worst case, it has zero effect. It's innocuous. It doesn't reduce or increase the likelihood of substance use.
That's the worst case. Okay.
Worst case. Best case is that it's a protective factor and that we see rates go down. So this is a common misconception and an understandable one. But yeah, the research that's been done so far has shown that more often than not, it can be protective. So yeah, if you ever encounter that or get really concerned about it, I have tons of parents, especially as their kids become teenagers, get really concerned about that of, I've heard a lot about this, and parent groups. The research that we have so far does not suggest that it increases those incident rates, and that in fact it can be protective. Because you think about it, if it's an impulsive decision to smoke with your friend, to have that drink, to drink in excess, things like that, having that stimulant medication can help improve regulating and inhibiting, and not impulsively making that decision, maybe pausing and going, I don't know if I want to do that, or I'm going to get in trouble, and I have to go to home after this, and my mom's going to no way. So yeah, I want to make sure that gets dispelled.
And somebody says that makes sense, because a lot of substance abuse starts to manage ADHD symptoms, so medication would safely help manage. Essentially, yeah, if you're trying to treat your ADHD, and so if your ADHD is treated, then you don't need other substances to treat it as much, kind of thing.
Absolutely.
Yeah,
Absolutely.
That makes sense. A lot of people are asking about cannabis in terms of self-medicating. So I know I've talked to Dr. Carolyn Lynch Purcells about this. She was on the channel talking about it. I know you're not on the psychiatry doctor side of things, but do you have any thoughts on that?
What did she say? I'm curious.
So what she said, and what actually was said in the CHAD conference this last year by the keynote speaker who was talking about it, who researches it, basically the TLDR of using cannabis for ADHD is, in the short term, it can help people with chilling out, like, honestly. Like,
Telling what? I'm sorry.
with chilling the hell out, like,
Chill.
it
Okay.
it can help with relaxing, can help with ADHD symptoms in the short term, not with focus necessarily, but with the other issues of impulsivity and hyperactivity and stuff. It can help calm you down, right? But that in the long term, it can actually make those ADHD symptoms worse. So that was interesting. And then Carolyn also said it depends on how people are taking it, because I don't know, I don't remember everything that she said, but some ways are more dangerous or harmful than others. So that's something too. So basically the TLDR is, if you're going to do this, talk to your doctor and make sure it's part of an overall treatment plan, and make sure that it's actually a good idea for you, because it does impact your ADHD in the long run to be doing that. And also there are sometimes more effective ways of treating the ADHD. But that's maybe the first thing that some people stumble into, right? Like if kids weren't diagnosed and treated, but then in high school they start smoking, well, now this is how they're used to managing their ADHD, right? And so just like I'm used to using my medication to manage my ADHD, some people are used to using cannabis. So
Yeah, and gosh, there's so many points I want to touch on. The last thing you were mentioning about like starting cannabis early and maybe not having medication, isn't it sad that it's easier to access cannabis than it is to get medication to manage your disorder? Like
oh
that's
God,
sad
so
in and of
true.
itself.
Yeah.
So that's problematic. And it's so anecdotally, I've certainly had patients, and I'm not saying I agreed with them, just as an outside observer, saying that, yeah, no, I think I do focus better or I drive better. Don't do that. When I'm on, I'm smoking because it tends, like they say, like it slows things down a little bit. And a lot of times, again, this is mostly anecdotal, so preface that, but it seems to be more the co-occurring anxiety and stuff that's coming up, and using cannabis to regulate that because that can exacerbate ADHD symptoms. But I could see where, yeah, maybe in the short term, maybe because you're using it as a sleep aid initially, but of course that can become problematic, and grow to dependence. So it could be helpful for that or ameliorating some of the anxiety that you're feeling. And so then you're able to start that task more easily. But then in the long run, we know that it affects the executive functioning system.
That
And
cannabis does affect executive
yeah,
function?
that it
Okay.
builds up in your prefrontal cortex. Now, the tricky thing is because it's an illegal substance on the national level, there hasn't been a lot of research on it. I know Dr. John Mitchell at Duke, he was actually my mentor while I was over there, has started to look at some of this stuff. So I'd be curious as to if he's done anything recent with this. But yeah, there's more research that needs to be done, but I'm skeptical, and I certainly wouldn't encourage someone to smoke cannabis to manage their ADHD. I'd like to find other methods that we know more about, and can be done more safely potentially. But
Yeah. Thank you. I know
yeah,
I'm throwing you a lot of hard questions, and some of these I'm
no,
like,
I love it.
okay,
Yeah.
cool. Yeah, okay. Scott points out the term habit forming for prescription drugs confuses me. The biggest issues I've had with medicines is forgetting, not habit. Aren't you supposed to form a habit? Yeah, I can relate to that. Okay, so Laura, oh, this is a good question. And then, yeah, okay, so there's two more that I want to cover. The first one is, yeah, Laura's any links with overeating / binge eating disorder, especially undiagnosed, untreated ADHD. Also, I'm an ITU doctor who's newly diagnosed with ADHD. Just want to thank you for being one of the best sources of info I've found during this time. Thank you. And Patrick is part of why this is one of the best sources of info. So thank you for that. Yeah, whatever he doesn't know, he goes and pulls research papers and comes back to me with answers later. It's great. Overeating, binge eating disorder. This is also something that I have struggled with. I was an actress in Hollywood for a while, and I was told by my manager constantly, lose 10 pounds and we'll get you a pilot. And I was constantly going on diets and then constantly falling off those diets and binging. I went back and forth from dieting to binging, making sure that I'm working out, paying lots of money for personal trainers and trying everything to get my food under control, and then binging. And then with medication, it was even harder because I went off my meds. I had a boyfriend convince me not to take my medication once, and I went off of it for 3 months, and I gained 30 pounds in 3 months and was like, I lost my job, and like I decided to start a career as a stand-up comedian. Like I made just some interesting life choices during that time, but I did struggle with food for so long, and it's only recently that I have a positive relationship with food. So do you know anything about that comorbidity?
The only thing, so if there's one big, like, I know if I get this referral from a community, I tend to refer out is eating disorders. It's one hole in my training that's unfortunate. But what I do know is that they have started using stimulants off-label for binge eating disorders. So I'm not sure as far as the research on it, but I know prescribers have started to do that. And certainly, I've heard a lot of kind of, yeah, I take my stimulant in the morning, and then, throughout the day, I kind of like, I'm just not hungry. It suppresses your appetite, right? So then eventually, kind of end of day, my medication's wearing off. Oh my gosh, like I'm hangry, like, and like, oh, okay, I need to inhale this pizza. And then afterwards, like, oh, like feeling that shame and guilt. And uh, so I could see that being, particularly if you're taking medication already, but I don't know. That's a good question. And now I want to nerd out and go research that question. So yeah, be sure to leave comments on that so then I can answer that. That's a really good one.
That's something to talk to Dr. Carolyn about too. Lynch
Yeah.
Purcell's, that's her specialty, is eating disorders.
Cool.
And she also
Perfect.
does ADHD. So, yeah, okay. So let's see. What I wanted to get to next, I keep seeing people asking about tics. You said that motor tics did you say that's the most common comorbidity?
No,
Or it's one of them?
no.
Okay.
It's one of the like top 5, I think, from the MTA study. And more often than not, I'm not sure if I've seen that much in absence of medication. But oftentimes that's indicative of, you might be taking too much of a medication and they need to dial it back.
I think I remember. I'd have to go back and look. I was diagnosed with motor tic disorder as well, and my tics are like I'll crack my arm compulsively or crack my knuckles compulsively. Sometimes I'll flex my neck muscles. There's a few things that I have, and so I was diagnosed with motor tic disorder as well. And I went down the research rabbit hole on that. And what I saw is that a lot of times it's attributed to the medication, but there were studies that showed that motor tic disorders develop anyway, but they often get noticed once you start medicating because you're looking for symptoms, right? So you're looking for side effects of those meds.
That's true.
So you
I can see
notice
that.
them more.
I
But
can
that
see that.
it either would have developed anyway or it was already there and you just didn't notice it. But once you're, taking stimulants, you're like looking for anything that could be. I don't know what it was for me. I don't remember which came first, but I do have motor tics, and it's embarrassing, to be honest. I'm at the point now where I finally accept that I have ADHD and I accept the things that come with it, and I accept that these things are not my fault and that I don't have to feel embarrassed about things that are just, this is how my brain is wired. But for a long time, I was really embarrassed and I would try and hide it.
Yeah. And I've worked with some people who, and great for them. Like one person that comes to mind, they did their eyes like really intensely, or like nose stuff. And they said, we've tried to dial back medication and it does go down a little bit, but then I don't feel like I get the same effectiveness for my meds. So, managing those two competing things can be difficult. But yeah, definitely the social aspects of it can be hard.
Mm-hmm. Do you know if there's a way to treat tics?
So tic disorders, I think they generally get classified. So the same type of treatments, I'm assuming we're just talking about psychological treatments, so therapy, is they kind of get caught in with what's called like excoriation disorder. So that's like skin picking, or trichotillomania, picking your hair at various parts of your body. Is a lot of times you're replacing that impulse with something else, which is really interesting. So you're not trying to extinguish that urge, because a lot of people with these kind of motor tic disorders, things like that, is if you stop, they kind of describe it as like it's building up tension, and it's like, I need to release this.
I can see that.
So
yeah.
if you have like a vocal tic, you might like need to like cough several times like afterwards because it like built up so much. So it's not like you can just extinguish it. A lot of times it seems like the prevailing treatments is to replace it with a more socially acceptable type of tic.
So rather than try not to do it, do something else instead. That actually makes sense. And I do notice that sometimes I do that instinctively. I'll fidget with my ring instead, or I'll massage my hand or something, and that actually does help. Interesting. Thank you for that.
Yeah.
And Cornshot says, I take Intuna for my tics and ADHD. Okay, so, God, you guys have so many good questions. Zoe, what is it called when you can't put what you feel into words? It makes my mind go blank. I don't mean official diagnosis, but the feeling. Is this common in ADHD? So that's alexithymia. alexithymia, which is do you know much about this?
I have not.
I
Yeah,
love that I'm at the point where like I can teach Patrick stuff. I'm like
that's right.
I've learned
That's
things.
right.
I've read these
Well,
research
you
papers.
teach me so much every time we talk. I don't know what you're talking about.
That's awesome.
Yeah. I'm like, oh, I didn't even know that was a thing the ADHD community was so passionate about or were experiencing difficulties with.
Yeah. So alexithymia is, I think the research on it is something like affects 10% of the population, is what I saw, where it's basically you don't have words for your feelings. You don't know how to express how you feel. Like maybe you know you're stressed or anxious, but you don't know the more specific terms. You can't tell maybe sometimes when you're hungry until you're really hungry, or you can't tell that you're sad until you're melting down in tears, or you can't tell that you're starting to get irritated. You just know like when you're angry, right? And so right. And so alexithymia or dyslexithymia, which is the wrong words for emotions, where you're like, I'm pissed, but really you're sad. And you just don't know that you're sad and it's coming up as I'm angry because you can't differentiate, is something that affects the autism community quite a bit. I think something like 60% of people on the spectrum will have alexithymia, but according to one study that I read, but for ADHD, it's lower, but it's still there. It's still common in ADHD to have difficulty explaining your feelings. And
That's so interesting.
yeah.
Yeah, and I would imagine too. So this is a tangent, but we'll bring it back. I hopefully it's related, but it just makes me think of, so especially as a guy, I see this a lot with men, where you don't get a great vocabulary emotionally. So even going to grad school, so going into my PhD program, and we have like kind of like teams that we see cases with, and so there's themes to those. And I was on like a depressive team, and they were talking about how they gave a patient kind of like an emotion wheel to describe different emotions. And I was just looking at it, I was like my emotions. So I grew up playing hockey, were always I'm mad, I'm pissed, I'm upset, I'm frustrated. Like that was my vocabulary. Sad, anxious, worrisome, jealous, like that just, it wasn't there. And I had a hard time really understanding, when was I sad? When was I worried about something? And the other point you mentioned too about kind of understanding your body and am I actually hungry? Like I'm sure a lot of us experienced that during quarantine of going to my fridge and just being like, am I hungry or am I just bored? Like, I've been back here 5 times in the last half hour. Maybe I'm not actually hungry. So that's interesting. Man, you taught me some. Dr. McCabe, school's in session.
I'm really hoping at some point that some university gives me a doctorate. That's like an honorary doctorate. That's all I want.
We're going to make it happen. We're going to make it happen.
I need this. I dropped out of community college and I'm so sad,
We're
right?
going to make a hashtag. We're going to do all things.
I feel like it. PhD. I feel like I've put myself through neurodiversity university at this point. I've learned so much about it. Okay. I'm seeing a lot more questions about autism again. So is it common for one sibling to have autism and one to have ADHD? I see this a lot. My brother has autism.
Yep.
And then people were asking earlier, like, are they different? Or are they kind of the same thing, just different places on the same spectrum?
I think they're noticeably different. So I'm trying to remember, there's the social communication aspect of autism and the other one's more behavioral. And those, you can Google the criteria for autism spectrum disorders. They're categorically different. I think they can manifest in a lot of the same ways, but it's like, okay, you can have ADHD, but the rest of the other things, not so much. Yeah.
Okay. Yeah, somebody says...
Looks like they're deciding to clean off the walls outside my apartment, so I'm sorry if there's noise.
Awesome. Well, people are appreciating it. Sam says, I love Patrick. He is so smart. Isn't he great? I love it. Let's see. Panic disorders. Can you develop panic disorders along with ADHD? Are they related? Are they circumstantial?
Yeah, I mean, certainly. I don't know if there's anything that you can't develop. in concert with ADHD. Like the question is like if it's common. I don't know if that's the most common one, but certainly you can have them both.
Mm-hmm.
Yeah.
What's the difference between generalized anxiety disorder and panic disorder?
Oh, yeah, that's a great question. So panic is a hallmark example of that. This will happen a lot is people going to emergency rooms because they're thinking they're having a heart attack. And then it's so common for them that they know like, hey, so we look at your EKGs.
Oh my God. That's what happened. That happened to me.
Oh.
That exact thing. I had this horrible tightness in my chest and it felt like I was having a heart attack. And I was like, I am young and I'm a woman and like I eat healthy and I exercise. Why am I? But it was so bad and so persistent that we actually did take me to the emergency. I'm going to get emotional because I didn't associate that. Like that's exactly what happened. And I was so scared and they rushed me in and they treated me like I was like being ridiculous, but it really felt like I was having a panic attack. They were like, nope, nothing, or it felt like I was having a heart attack. Nothing happened. But the reason I hadn't associated that is I actually have had a panic attack. I had a panic attack. I don't remember if it was, I think it was maybe a year later, but it was different. It wasn't that, it didn't feel like I was having a heart attack. It felt like everything was unraveling. Like everything was falling apart around me, almost like I was made of string and somebody was, or, you know, like I was knitted and somebody took a string and they were just unraveling the whole thing. Like it felt like everything that I had worked so hard for with the channel, I was behind on the channel and something was going wrong and I had to get to work, waiting tables, and there was just so much going on. And I had this feeling that I was going to be, like it was all going to fall apart. And some people talk about they're going to die, but I felt like just everything was going to go to hell. Like,
yeah.
And that was the one time I thought I had a panic attack. I thought that was my only panic attack. And since then, I've almost had them and learned how to manage them. But I didn't realize that time that I went to the ER was probably a panic attack. So it's interesting that it shows up in different ways.
Yeah. And of course, it can manifest in the way that you just described, where it's just this sudden, like, overwhelming feeling of like something is wrong and bad and I'm in danger and I need to escape. Yeah.
Sorry guys, I got off track for a second because I just had one of those aha moments. I think a lot of people get watching the channel like, oh my God, that's why. Like I just had that. Man, I just like got a collect them all bingo card of stuff with ADHD. So for those who haven't been there the whole stream, I am not only diagnosed with ADHD. In high school, I was diagnosed with mild OCD. I'm currently diagnosed with ADHD combined type, generalized anxiety disorder, a motor tic disorder, and I have had panic attacks. I also deal with trauma, which people are asking about. And I've looked at PTSD to see if I meet some of those criteria as well. I don't think I quite meet them, but I have had a lot of trauma. So let's talk about that too, like trauma and PTSD.
Yeah. And so and there's this difference between, I think, this is another great example of where I think clinicians, experts, researchers, the way we use PTSD versus the way like the community uses PTSD. So the biggest distinction between those two is that it's called criteria A. So it has to be an event where like your life was in danger, you observed something where somebody else's life was in danger, was in serious harm or threat. Like the threshold for the type A criteria is fairly high. And that's where a lot of people, they're like, oh, I have PTSD. And it's like, you don't meet that one thing. Now, that doesn't mean you can't experience trauma related to that. And there's separate disorders. Acute stress disorder, I think, is one of them. But it doesn't quite meet that threshold of a criterion A category. And then, the traumatic re-experiencing of those events. So it's really easy to conceptualize it with veterans, so I'll avoid that just because I think we all kind of have heard those in media and TV shows. But maybe like vehicle driving. You got in a motor vehicle accident, and so you will not, go down a certain stretch of road, a highway, because that was either the one that you were on or just the fear of that in relation to a car accident. Maybe you have dreams about it. All of a sudden just rushes of emotional distress that when you just hear about a car accident like that, it rushes over you, can be another example. So again, kind of like what we talked about before, certainly it can co-occur with ADHD. I'm not sure if it's markedly higher among individuals with ADHD.
Do you know how
Yeah.
to differentiate? Because I was diagnosed, the interesting thing is I was diagnosed with ADHD around the same time that I was going through some serious trauma. My mom was in a car accident with a drunk driver. It was a head-on collision. It was a car that I was supposed to be in, but I decided to be selfish and I wanted to go hang out with my friends instead of go with my mom to this thing. And so I felt a little bit of survivor's guilt. And then 2 of my mom's friends died in that accident, and my mom was severely injured to the point where she would never heal. And I lost my mom last year, and I probably wouldn't have lost her so soon if it hadn't been for this. She had to be on some really heavy painkillers her whole life after that. And it also, neither driver, my mom wasn't driving, but neither driver had car insurance. And so we were out, we didn't have money, and sorry. I didn't mean for this to be a therapy session. Sorry, Patrick.
You're good.
We were out of money. We couldn't afford to. My parents couldn't afford to send me to the private school I'd been going to, and so we got transferred to public school. And we were going to a Christian school, and so I lost kind of my friends and my faith and my school and both of my parents kind of at the same time, because my mom was in a hospital bed and my dad didn't know how to deal with it. And I started acting out a lot after that because I didn't know how to handle it. My ADHD that had been so, I hadn't been diagnosed because it had been so well managed before. Like, yeah, I lost things all the time. I came home without sweaters. I got distracted. I had trouble making friends, but I had this family that was so supportive and so able to support me. Thank you guys. So able to support me through all of this that I was okay. But after that happened, like, it was so hard for me to focus on anything, and the trauma and being yelled at for not being a good daughter, right? All my ADHD stuff that got in the way of me supporting my mom and my family the way that I felt like, or they thought I was supposed to, right? I got a lot of judgment too of like, you're a bad daughter and you should be doing more for your mom. You should be helping her. And I was so angry and emotionally dysregulated. And after that was when I got my ADHD diagnosis. And there's sometimes where I'm like, I wonder if my ADHD wouldn't have been as bad if I hadn't also gone through that trauma. I wonder how they affect each other. I wonder how much of what I struggle with actually is trauma, because I'm going through trauma therapy now, and some of what I thought was ADHD actually was trauma. I definitely still have ADHD, but the trauma therapy is helping me cope. So I don't even know what the question is anymore, but thank you guys for being so supportive.
I was going to say, just before addressing that, I think it's important to acknowledge, I love your vulnerability, Jessica. I think it's what makes you so great, and just how genuine and real you are. So thank you. As far as, assessing for and diagnosing ADHD when there's a co-occurring traumatic event like that, that's where, the history part is so important, because you want to make sure you're not labeling someone with a chronic disorder when it was really an acute event that better explains what's going on. And certainly PTSD will exacerbate that. I don't know how it couldn't. So as far as how we go about assessing it, it's looking at history and making sure there was evidence of it before this event, and making sure that it's not completely or likely to be explained by PTSD or this traumatic event. So, I don't know if that answers the question.
But I'm curious, if it makes it worse. Let's say you have ADHD and anxiety, or ADHD and depression, ADHD and PTSD, ADHD and these other things. Can that actually make the ADHD worse, or is it just harder because they're compounding, I guess?
It's an interesting question. So, because therapeutically, I might challenge someone to think, well, is it worse or is it different? Like, why are we adding a label to it? And objectively, sometimes it's worse, right? So you are anxious approaching a problem because I just have so much experience with struggling in reading, and I have to do this tonight, and it's particularly hard because I have ADHD. So certainly it can make stuff like that more difficult, but maybe it just changes how you approach things. For anxiety, another common one with ADHD is the perfectionism of it has to be just right. And there's reasons that individuals with ADHD might be more prone to being perfectionists. And it's because, well, if I have things just right, if I have my routines, if I have my consistency, my life stays on track. And if I deviate from that, then that threatens it. So, yeah.
I know, and here's the thing, and here's where they interplay for me personally. I was talking to my trauma therapist, and the interesting thing is, like, with ADHD, I'm impulsive, I'm hyperactive, I'm easily distracted, I'm constantly seeking stimulation, like a lot of people with ADHD. But I think it interplays with the trauma in the sense that in relationships, I was essentially reenacting my trauma. When all of that went down with my mom, my dad checked out. Like, he couldn't handle it. It was too much for him. And so he emotionally abandoned us, essentially. He was there, but he wasn't there. And we think he had undiagnosed ADHD and depression as well. So there are reasons why he couldn't handle it and why he couldn't be there for us the way that we needed him to. But I saw that my mom was still the one present and parenting us, even though her body was broken and my dad checked out. And so I kept jumping impulsively into relationships, thinking it was my ADHD, like, oh, why do I keep impulsively jumping into relationships that aren't good for me? My trauma therapist is like, you're reenacting your trauma. You keep choosing people who are emotionally unavailable in some way, or who can't be there for you, not because they don't want to be, but because of, they're dealing with addiction or bipolar or borderline personality disorder or depression or whatever. They're dealing with something that means they can't be there for you in the way that you need because you're reenacting your trauma. And so even though it's my ADHD impulsivity going like, yes, as soon as I meet this person, hi, I love you. And, I just met you and I already love you. What, like Doug from Up. It's still trauma that I'm reenacting impulsively. So I don't know. I just think that's interesting. I know we're getting to more of a philosophical conversation now, but
that's what I love about our conversations. They steer off, they come back. Yeah.
Survival skill. Here we go. So did that just because you're used to, let's see. Yeah. All right, let me see. I'll probably answer a couple more questions and then let it go because I think I need some self-care after this. Sensory issues. So somebody asked specifically, is there any research that connects being in or underwater and the reduction of sensory issues? I teach swimming and found that my neurodiverse students and I seem to feel better when having sensory issues and we're submerged.
So when submerged, they're better, or you encounter? Okay.
Yeah, which actually makes sense to me because if you're overstimulated from a sensory perspective and you're getting rid of some sensory things. I love swimming. I was on the swim team. When I was 5, I wanted to be a fish when I grew up. Like, I was in the pool all the time. I definitely experienced that. I felt better when I was swimming. But part of it was the exercise too, right? Patrick does a lot of research on ADHD and exercise. And like, how does it help? Yeah. How does exercise help?
Yeah. Oh, should I explain?
Yeah.
So prevailing theories right now are, and there's a great episode on this, so check it out. Worked a little bit behind the scenes on it. Is it mimics a lot of, like, as far as neurobiologically, the effects of stimulant medication. So with norepinephrine and dopamine. And because of that increased activity in the prefrontal cortex, it can help improve ADHD symptoms and related impairments. So that was actually part of my dissertation. So my advisor, Cynthia Hartung, fantastic woman, and is continuing on with this work. We're working on publishing that. But it basically, what we found, at least in our study, was for those with ADHD, so we had those with and without ADHD, exercise benefited both groups. But those with ADHD exhibited a greater degree of improvement. So that slope from pre to post was greater for individuals with ADHD in domains of, I believe, anxiety, inattention, hyperactivity, impulsivity. So we saw great improvements in, mood-related outcomes, but also the ADHD symptoms. So yeah, promising stuff, and it's forthcoming.
Yeah, it's really cool. I'm about to get an elliptical for my place, and I'm so excited about it. I just want to ask one more question because Carla's been patiently asking this question, and it's also another area of your expertise. How to best parent to prepare kids for adulthood? So they have, or Carla has twins, age 16. Boy has ADHD, depression, anxiety. Girl has ADD, OCD, hypermobility. What resources are available to prepare them for adulthood?
Boy, that's a good one. So, yeah, that was a lot of work I did later on. And you can look up the work of Margaret Sibley. She's out at Seattle Children's Hospital and University of Washington.
How do you
She was
spell
also a
that?
mentor.
Margaret.
Sibley. So she also wrote a book on, it's a collaborative treatment with parents and teens for ADHD. And it promotes a lot of engagement because that's one issue with a lot of treatments right now for teens is getting them to be engaged and feel like they're in it. And it's not just parents are forcing them to do something. And trying to navigate, okay, what can parents give up so then the teen can develop autonomy and independence, but not let them flounder, but also support them, but not coddle them. Like that tends to be the theme throughout with teens, particularly like in high school and their parents is the teen desperately wants to be independent, but we're not ready for that. Shoot, I was in college and I didn't feel ready for that.
Yeah.
And then parents, same thing as, maybe they want them to be independent or maybe they want to kind of micromanage. These are kind of the two ends of the spectrum is the helicopter versus kind of just completely disengaged and trying to find that balance of, okay, I want to give you opportunities to develop and demonstrate your autonomy. But I also don't want you to drown because, that's not helpful for anyone.
What was the term for it?
Sure.
Scaffolding?
Scaffolding. Mm-hmm.
So you want to provide them as much support as they need now and then slowly kind of take it away and give them ownership over it and then also work to collaborate with them, which I really wish my parents had done because my mom understood really hard that I struggled with ADHD and so she did a lot of things for me. But the problem with that was like she would be the one to do my laundry and she would be the one to make sure that, I don't know, I woke up on time or whatever. But then when I left the house, suddenly I had to do all of these things on my own for the first time ever. And on top of going to college, on top of trying to maintain a relationship, on top of having a job, and I just fell apart. Like my place was a mess, and like my relationships weren't good, and I ended up dropping out of community college because it was just too much. It was too much, and so your kids, if they're 16, if they're going off to college or they're gonna go get a job or move out or whatever when they move on, I like that idea of like collaborate with them, figure out the level of support they need now, and then slowly work toward the level of support that they're going to be having because then they're going to need to do it on their own.
And what's really hard too is, I'm not a parent, but I grew up in a family with 6 brothers and sisters, my mom, so I got to see her try to navigate these issues. But I can sympathize with both ends, the wanting to micromanage and just like, I want, like you love your child, you want them to do their best. And this feels like, in the short term, at least, they're getting better grades. They didn't miss that assignment. They turned in that application to college. Like, of course, I want to do that. Even if I am micromanaging or doing some of it for them, that does happen. I want to normalize that. That does happen.
Yeah.
And then the opposite end of the spectrum too, where it can be exhaustion and or just, look, man, you're 17. When are you gonna get it? Like, I've heard both of these, and I can empathize with both of those because no one gives a manual on how to, parent a child with ADHD. And how do you find that middle ground? And also try to let go, particularly with the kind of helicopter parent side of things. Yeah. How do you let go a little bit and
let them mess up?
Because this is a really hard thing to get into, but it's safer now that your child, missed an interview, made some kind of mistake. They're a minor, they got school, they've got a lot of eyes on them. But if they're by themselves, they're in college, they're doing their first trade job, all those things get pulled away. So it feels like, no, I don't want have my kid, study by themselves and then potentially get a C or a D on that test. Like, don't you know the ramifications? Yeah. And do you want them to do that now or do you want to do that later? Like, which is, again, I get it. And it's really, though, just engaging the family and making sure we're following their values on treatment. So, not what's important to me, but what's important for you guys and how can we meet that goal collaboratively?
Yeah, that was really well put. The collaboration, I think, is the key.
Yeah.
We went to therapy when I was 15, and like my parents were like, "And we're gonna use sticker charts," and I'm like, "No, you guys missed the boat on. Like, we're done. No, like I've already been raising myself for 3 years. Like, no, we're not going back to that." I pushed against it, and I figured it out myself. But I could have used some more collaborative support for sure. Well, I will wrap up on that because I need to go cry and do some self-care and some processing, which I'm learning to do right away instead of like continuing to go and then, 3 years down the line have a complete mental breakdown and have to process all of it. I'm trying to process things as they come up. So I'm going to go do that. If anybody wants to ask any more questions of Patrick, he has generously offered for today, and I think for tomorrow a little bit too, go through and answer some comments. So once we end this, the live stream will still be available as a video. You can comment underneath it, and Patrick will do his best to answer things. There might be questions that he doesn't feel comfortable answering because either he doesn't have context or the research isn't really strong one way or the other. It's outside of his area of expertise, but what he can answer, he will. And if anybody wants to work with Patrick, he is available. He's in private practice now, practical psych services. He does ADHD evaluations, assessments to kind of help suss out, hey, what's the ADHD? What else are you struggling with too, right? You do all of that.
Yeah, absolutely. Yep.
So he's not cheap, but he is worth it. And considering how much we pay in the ADHD tax and the everything tax if we don't get proper treatment, if it's possible, like I would recommend working with somebody who really understands ADHD like he does. He's been researching it for years. This is his focus, and specifically ADHD and like emerging adulthood, supporting people in terms of being able to be functional and happy adults, and
to thrive.
And to thrive.
Like, not just like you're broken. Like, what can we do to make life work for you?
Yeah.
So,
he does cognitive behavioral therapy and sets goals and check-ins and all that. So I can't recommend Patrick enough. Obviously, for ethical reasons, I haven't been able to be a patient of Patrick's because we're collaborators. But everything that he talks about with me, he knows his stuff. So, but that's only if you're in Colorado because that's how therapy works. He can't practice outside of Colorado. All right, I will talk to you guys soon. Bye, Rains. Thank you, Patrick.